Want to look younger? Well, you've got a myriad of options, but with some you might wonder, will this even work? Not with the vampire facelift, and that's why so many people are talking about it. Dixie Hale is here to explain why it appealed to her. Also with us, Dr. Melissa Loseke and Dr. Charles Reynolds, both with Restorative Health Omaha. It's nice to see you, and Dixie, good to meet you.
You too.
We'll get to your story, but I think we should start with a foundation about the vampire facelift. How does it work and why does it work, Dr. Reynolds?
Well, we basically took the technology that's been around for the last 10 or 15 years that the NFL uses to rejuvenate the knee. Orthopedic surgeons have used it, dentists have used it, using growth factors from the bloodstream, hence the name vampire, to rejuvenate tissue. So the same factors that rejuvenate the tissue of the knee also work in the face. So I'm the inventor, but I came here to promote Dr. Melissa, who's one of our star providers.
Yeah, and you'll see that online if you hear about the vampire facelift. It's exclusive to certain places around the country, and indeed, Restorative Health is one of those places here in Omaha, so it's not like this general term. It is specific. It is, I'm sure, patented, this process. So what do we see? What kind of difference do people notice? The benefits, is it just about getting rid of wrinkles? Aesthetically, what do we see?
Well, when it comes to any appearance of anything, there's shape, color, texture, and this helps with all of those things. It helps restore shape and help with color and texture so that you have a more rejuvenation, but still a very natural look, but a younger look.
It's natural, and that to me would be part of the draw, that you still want to look like yourself, just a better version, right? Yes. What did you want, Dixie?
As I aged, I felt like I needed to look fresher. Even though I'd get plenty of sleep lots of times, I still looked tired. And I felt like my skin was looking saggy and...
A loss of volume as we get older, you start to see that. Here are a few images. The one on the left, that's when you went into Restorative Health Omaha.
Yes.
And then on the right, how much longer after you had the vampire facelift did you see the results that we see in this image?
Well, the before picture, I had my procedure done last summer.
Wow.
So the one on the right is a more recent picture. I believe that was done in February.
Why this compared to something that's more invasive?
I didn't like the idea of invasive, and so I felt like that this was an easier way to go for me. I'll try this first, and I have been perfectly happy. I mean, very excited with it.
Dr. Loseke, who do you see most when women and men, I'm sure, come into you?
Anyone. You're never too young. You're really never too old either. As you age, we want to age gracefully. We want to look beautiful. And so it's appropriate for absolutely anyone.
Are some people scared by the name, the vampire facelift? Like, what does this entail before they learn about it?
You know, maybe a little bit, but as you sit down and talk to them and explain it to them, make everyone very at ease, and they're very comfortable with the procedure.
And to know that the concept has been around for some time.
Exactly.
It's just using it in a slightly different way so that you start to notice the difference within your face, bringing that youthful glow back, getting rid of some of those wrinkles, evening out texture, as you saw. There's another procedure called the O-shot. So let's switch gears a little bit and talk about it and who it's for.
Again, for women. I don't know if you want to elaborate a little bit on that, but appropriate for women. It depends on what our goals are and what we want to achieve, but it can help with sensation. It can help with urinary incontinence. So again, you're looking at women in their 20s as old in their 70s and 80s.
So age isn't as much of a factor as you might think initially.
It can be, but absolutely not as much as you would think.
It's about relationships. And why do we want to be beautiful? So that we can feel good about ourselves, so that we can relate to people on the job, so that we can have relationships. And sexuality is about that as well. Well, the same technology that applies to rejuvenating the knee and the dental procedures and the face applies to the urogenital tract. And so I'm very grateful for you being bold enough to broach the subject that with sexuality. But sexuality is not just pleasure, it's families and relationships, which is why I'm so passionate about being here to support Dr. Melissa, because she understands she's a young mother, but she's also a physician taking care of women And this procedure is, we have 2 research projects now that have been published, and it's changing lives about restoring that
I think
balance.
it's important for women to not feel embarrassed, to not feel like there's some sense of humiliation about it. If there's something available that could help you.
There's a sex revolution going on, and it's that people are talking. If 50 Shades of Grey did nothing else, it opened the conversation, and women are no longer wanting to be silent. There is no drug approved for women to help them with their sexuality. There's over 20 for men.
For men.
And we have a procedure that helps.
Dixie, is this something that would appeal to you or has?
I have had that procedure done. I did the procedure mainly for the incontinence issue, but honestly, I mean, it helped. I got the bonus of it all, so I was real thrilled with it.
Oh, great. Well, it sounds like you're looking great, you're feeling great.
I am.
Life's good for you.
It is.
And for our viewers who are interested in either the vampire facelift or the O-Shot, what is the best way to get started? A consultation?
Call us, come in, schedule an appointment, consultation. We're happy to talk and discuss it.
And it's free if you schedule that consultation today. Just mention the morning blend when you do call. It's 592-9000. And then how much time does it take? If I think about something that's super invasive and I'm healing for a long time, vampire facelift takes how long before I'm back to real life?
Less than an hour.
Less than an hour. Oh, please. And the other? You're holding your hand up,
Yes.
Dixie. What?
I had the procedure done in the office. As soon as the procedure was done, I freshened up my makeup. My husband and I went out to dinner with friends. That's how easy and quick.
No bandages, no
No
staying
bandages.
at home for a few weeks until you're ready to get out. So it's 592-9000. Again, free consultations if you mention the show, and you see the hours, the location there on the screen, and online. The website's a great resource to learn about the services we've discussed here and others. It's restorative-health.com. Dr. Reynolds, nice to meet you. Dr. Loseke, good to see you.
as
And
well.
Dixie,
Thank
thank
you.
you for sharing
Thank
your
you.
story.
Thank you.
Really a pleasure.